Good afternoon, everybody, and welcome to this United Way Leadership Forum on the new face of the uninsured. My name is Steve Rothschild. I'm a director of the Greater Twin Cities United Way, and I'm chair of the Community Impact Committee of the United Way. The Community Impact Committee, for those of you who don't know much about the United Way, is responsible for helping to establish the goals and the strategies that the United Way utilizes and overseeing the implementation of those strategies in the community. I personally have an interest in this subject that goes beyond my United Way affiliation. I was a corporate officer at General Mills for many years, and I saw what the advantages to our company were of having employees who had health insurance and didn't have to worry about it. That leads to more productive and more effective employees, and therefore led to a company that would meet its objectives more than not. As the founder and current chair of an anti-poverty organization called Twin Cities Rise, which works with very, very poor people, particularly men of color, I see the flip side of that coin, and that is the lack of health care, the lack of insurance on the part of many of the people we work with is a major preventative in their lives in helping them to establish economic independence. And so this issue of being uninsured, as I think many of you know, has a direct impact on those people who are affected, but just as importantly has an indirect impact on many stakeholders in the community. Well, our agenda for lasting change focuses on 10 goals in 3 impact areas. And the 3 impact areas are basic needs, which would include things like lowering homelessness in our community, decreasing hunger, increasing financial stability, focusing on children and families, and an example of that would be investing in early childhood education. And finally, the area of health and independence, which is a key priority area for us. And within that is embedded ensuring that the uninsured become insured. The other thing you should know about us is that we have moved over the last 5 or 6 years to focus less on middle-class issues and more on the issues of the poor. And our focal point is for people who are making less than 200% of poverty, which is about $44,000 for a family of 4. And within that, even more concentration on people who are making quite a bit less. Our approach is also expanded from the United Way that many of you may know. We are still providing investment in the community through our agencies. That hasn't changed. But we're doing some additional things. We are very active in trying to help stakeholders redesign systems so that they become more efficient and more effective in delivering services. And we have a number of projects underway in that regard. And secondly, we are going to take a more active role in influencing public policy. Now, that doesn't mean that we're going to be advocating every issue that we think is important, but we are involved and will become more involved in educating the public, in informing decision makers, and occasionally advocating a position. The first one is to increase the awareness of the consequences to the community when people lack health insurance coverage. I think most people and policymakers agree that people are better off if they have health insurance to help them pay their bills and ensure that they receive needed treatment. But the lack of insurance also has consequences, as many of you know who are engaged in this world, to hospitals and clinics, the community, businesses, and government alike. The second goal is to promote a respectful, nonpartisan, and fact-based policy discussion. We share the goal at the United Way of everyone being covered. But this topic can become very divisive, as some of you may know, both in the political arena and in media coverage, because it often doesn't inform the public about the real issues that need to be dealt with. Our goal today is to support a discussion about private and public actions that could be taken to mitigate the adverse consequences to the community when people lack health insurance. And we're going to focus on the immediate crisis that looms because of the scheduled termination of coverage for over 30,000 Minnesotans in the General Assistance Medical Care Program. Our third goal is to support the efforts currently underway for a quick resolution to the GAMC crisis. Now, the Greater United Way is not advocating for any particular solution, nor are we experts on this issue, and it's not our intention to become experts per se. However, we know that this is a major crisis for the low-income, vulnerable people that we serve and for the community partners whom we work with. Our final goal for today's forum is to highlight key points of pending federal reform and local impact. Healthcare reform at the federal level is clearly relevant to our discussions today, but the outcome is uncertain, as you well know. And even if substantial reforms are passed, including federal financial assistance for Minnesota's GAMC population, the federal changes aren't going to take place for some time. Federal reform that only covers people by subsidizing care is not sufficient, however. We need new solutions that change how health care is organized, delivered, and paid for so that it is affordable and sustainable into the future. In summary, we believe that we're in a new world with new faces of the uninsured, and the new challenges to our efforts to get more people coverage are real. We need policy making that unites rather than divides, people who share the common goal of averting a health care crisis. We all share the responsibility of creating an environment in which policymakers can make sound decisions that serve the best interests of the entire public. The United Way is sponsoring this forum because access to health care for the uninsured is a top priority area for the United Way. And we view our role as kind of twofold: to provide community leadership and to serve as a partner and convener of community leaders, policymakers, and stakeholders to work together toward a solution of increasing access, and to present the facts, research, and balanced information to increase the understanding of the public and that to ensure that policies are effective in the community.